All right, welcome to Deuk Spine Institute. We are performing Deuk plasma rhizotomy. It's a new technology. It's patented from Deuk Spine, where we're going in and deadening pain nerves to painful joints. And in this case, this patient has right sacroiliac joint pain. We're getting ready to get started. You can see on the x-ray his SI joint. I've already treated the first nerve. Show us where I did the first burn, Jordan, before you guys came on, right there, okay? And now we're getting ready to do our second burn. You can see the probe is down there by the foramen, okay? And now I have to get it in position, and then we're gonna start our second burn for the SI joint. Shot? All right. Let me just feel around and get my markings. You want to be straight on the bone. Shot. You want to be on the bone surface. You want to make sure you feel the bone. And then you do, honestly, it's really a kind of a tap dance. You know, if you prefer Ginger Rogers or Fred Astaire, your choice. But it's basically you're tap dancing around and you're trying to destroy the pain nerves to the joint. This is honestly a very safe area. There's really nothing here that you can hurt. I mean, if you go through the hole, you can hurt the nerves that go to the bladder. But you stay in the back and you won't hurt anything.
Can you have Jordan show up where the SI joint is?
Yeah, show us the SI joint, Jordan. Here, take another picture. That's the SI joint. Show that that's the bottom, and there's the top right there. You guys see that's the sacroiliac joint. Very common cause of chronic back pain. Cause of back pain in this patient. So I am going in and I'm denervating that joint. I'm destroying the pain nerve so that this patient doesn't have that pain anymore. Shot. I'm in the fibrous part of the joint, near it. Shot. Shot. All right. Let's head down. I'm almost done with this, Dr. B. Any questions about the Deuk plasma rhizotomy for sacroiliac joint pain?
No current questions on that, but we do have questions, follow-up questions from the previous live stream.
Sure.
This comes from Roscoe on YouTube.
Hi, Roscoe. Welcome to our stream.
They asked, what is the correct way to fix a cervical exiting nerve root that has stenosis?
What is the correct way to fix cervical stenosis affecting a nerve root? In my opinion, the best way to fix cervical stenosis is going to be the Deuk laser disc repair, the procedure you're watching here that we did earlier, but we do it on the cervical spine. That's what I would recommend. All right, we're done with this. We're going to move on to the piriformis release. All right, Jordan, you ready? Num num. So the piriformis muscle runs from the SI joint, or from the sacrum below the SI joint, in front of the sacrum, and over to the hip. Go. Come on, Jordan. Yeah. And you got the leg? Shot? All right. That's. Yeah, we want to rotate the leg. Go ahead. Can you verify injection?
Yeah,
Oh, okay. All right. Yeah. Shot. So the muscle attaches. I'm going to show you guys. Shot. Right where the circle is, that's where the muscle attaches, basically. So we're going to release it from that area. It's a 4 millimeter incision. It's done minimally invasive. There's virtually no bleeding. hold on. Shot. All right, that looks better. Let's, let me get down there. Shot. All right, so I'm going to dock on the back of the greater trochanter. It's called the posterior facet, right, Dr. Davis?
That's right. Still owe you lunch for that.
You still owe me lunch on that one. There it is. Shot. I'm right on it. Shot. Yeah, perfect. That's right where the piriformis is. So we're going to release this thing. And I usually go down to the neck. I could feel it right there. Huh? That's it right there. All right, and it's just below it right now, shot. Uh-huh. I can feel it. And by the way, when you do this, it's amazing. The piriformis pain goes away instantaneously. And I developed this technology as well. Nobody's ever done this before. This is new to the world. The piriformis release has been done, but it's done open, where doctors cut your butt cheek wide open and slice and dice you, and it's painful, takes forever to recover from. But this way, it's done with a 4mm incision.
You're one cut away from opening the joint and doing a replacement.
Dr. Davis is just jealous. All right, so you don't want to go beyond the femoral neck, the posterior cortex. I could feel it. Shot. And there's really not much here. There's no blood vessels that are dangerous. It's safe as long as you stay in this area. And you can feel the twang of the piriformis. Right? You guys hear it? All right, any questions?
Yes, actually.
We're done.
This question comes from Mark on YouTube.
Thank you. Before you do that, I'm going to show you, we did this patient's entire surgery. We did his SI joint treatment. By the way, other doctors are still doing fusions of the SI joint. There it is, 5mm incision, fix the SI pain. 4mm incision, fix the facets. 7mm incision, fix 2 discs and the pinched nerves. 4mm incision and fix the piriformis muscle. So that will get rid of about 98% of his back pain for the rest of his life. We just can't make his muscles like get big faster. Like he has atrophy in his legs. He's in a wheelchair. He's been in a wheelchair. Ray tech off, and now he's gonna, without the pain, he's gonna be able to walk. And so he's gonna need about a year of rehab, maybe 2, and then he'll be feeling like a normal human being. All right, questions?
Yes, this question comes from Mark, and they ask, what after effects does it have by releasing the muscle? What are they to expect afterwards?
Yeah, so when you do a piriformis muscle release properly, the only thing the patient feels or experiences is no more pain. It's gone. The piriformis muscle is absolutely useless. All it does is get hurt, and every time you walk or stand or whatever you do, any kind of movement with your hips or legs, you re-tear the muscle and you re-injure it, and you cause the pain, and it's severe. It causes pain in the top of the butt cheek and severe tenderness. It's very common. All right, blood loss is 3 mil. It's called an external rotator of the hip, and what it's supposed to do is turn your foot out, like make your toes move outwards. But you've got several other external rotators that are much better, and they do the job. You don't need the piriformis. It's absolutely useless. That's like saying, if I take my toenail off, what kind of effects will I experience? Nothing. I mean, your toenail's gone, but you don't notice it in your life. It's not part of your life. And if you have a fungus of your toenail, it's hurting you, you have pain every day, you want that thing out of there. All right, no complications, 3 mils of blood loss. Any more questions?
No current questions.
All right, we'll see you back in 30 minutes for the next surgery. Thanks for joining us.